What is the difference between propranolol and atenolol? Are you curious about the differences between propranolol and atenolol, especially when it comes to managing hypertension? Let's break it down in a way that's easy to understand. Both of these medications belong to a class known as beta blockers, which are often prescribed to help control high blood pressure. However, they have some key differences that can affect how they work for you. First, let's talk about how each medication acts in the body. Propranolol is a non-selective beta blocker. This means it blocks both beta-1 and beta-2 receptors. Beta-1 receptors are mainly found in the heart, while beta-2 receptors are located in the lungs and other smooth muscles. Because it affects both types of receptors, propranolol can sometimes lead to side effects like respiratory issues, especially for those with existing lung conditions. On the other hand, atenolol is a cardioselective beta blocker. This means it primarily targets beta-1 receptors in the heart. Because of this selectivity, atenolol generally has a lower risk of causing respiratory side effects compared to propranolol. This makes atenolol a more suitable option for individuals who may have breathing problems. Another important difference is how these medications interact with the central nervous system. Propranolol can cross the blood-brain barrier, which allows it to have effects on the brain. This property makes it useful not only for managing hypertension but also for conditions like anxiety and migraines. In contrast, atenolol does not cross the blood-brain barrier as easily, which limits its effects on the central nervous system. While this reduces the chance of central nervous system side effects, it also means atenolol is less effective for treating anxiety. When it comes to managing hypertension, both propranolol and atenolol can effectively lower blood pressure and heart rate. However, some studies suggest that atenolol may provide better blood pressure control in certain situations. This is something to consider when discussing treatment options with your healthcare provider. In practical terms, atenolol is often preferred for hypertension due to its cardiovascular specificity and reduced risk of respiratory side effects. Propranolol, while effective for high blood pressure, is also used off-label for anxiety because of its ability to affect the brain. In summary, while both propranolol and atenolol are used to manage hypertension, their differences in how they work and their side effect profiles can influence which medication is best for you. Always consult with your healthcare provider to determine the most appropriate treatment for your individual needs.